performing a relief of mitral stenosis. This is a narrowing of the main valve that leads from the lungs to the heart. When that valve becomes narrowed, it limits A, your performance, and B, your ability to breathe comfortably.
Medical volunteers have an opportunity to work on a variety of cases common to developing countries. Rheumatic fever is one of these familiar problems. Each mission requires a diverse team of medical specialists and students from all concentrations and medical backgrounds. No role is too small. Each volunteer is an asset to completing a successful mission. Teams are not only diverse in medical specialty, but in cultural background and language as well.
There were 5 different countries represented in the volunteers caring for this patient and the other patients we're doing this week.
And that's something wonderful, that no matter where you come from, what country or culture or religion, you're just here working for something that's our common purpose.
Yet another asset to a team's success is their ability to adapt using limited resources.
We're improvising in ways that I've never thought of before. And it's simple stuff that I could have walked down the hallway back home, and pulled out a bin and gotten it. And here, it's the difference of how the procedure is going to go, and frankly, how the patient is going to fare.
Biomedical engineers work around the clock to ensure that all the necessary equipment is ready for surgery. If a piece is missing, they find it, or make it using the resources available to them.
That's so difficult to fathom. Where we come from, where, science and medicine rules us.
Innovation is a reality medical staff at Hospital Delgado face every day.
On the last mission, we observed that the nurses didn't do any auscultation of the patient, didn't assess them using a stethoscope, and we investigated with them why, and found out it's just that they couldn't afford them, they don't have them.
CardioStart volunteers went back home and conducted fundraisers in their local hospitals. They returned to Hospital Delgado the following March with stethoscopes for every nurse in the ICU wing.
I could see nurses who have probably worked here for 20, 25 years, and they had tears in their eyes as they were receiving them. Maybe it was the first time they ever had it. And it was very humbling because we wear these around our necks like decorations, something we really take for granted.
Sustainability is key for the work of CardioStart International, equipping local medical teams with the means to raise the level of health care for their patients. Educational training is essential to this process. Volunteers perform daily comprehensive lectures and practical demonstrations in pediatric and adult care nursing management scenarios.
La gran oportunidad, ¿no?, de estar cerca del equipo de CardioStart, y sí he aprendido mucho.
I had the opportunity, a big opportunity, to be near CardioStart team. And yes, I learned so much. Our hospital doesn't have the necessary equipment and sometimes the materials. Now this opportunity that CardioStart has given not only to patients, but to nurses and medical staff too, is useful because it has allowed us to update new things and equipment.
Up-to-date equipment coupled with an empowered staff is a formula for improved, long-lasting results.
When you see those patients going back to their life and a very better quality of life, you feel happy, and so that's the drive. Yeah.
But in some cases, no matter how hard the fight, a few don't go home. In Florencio's case, despite a successful surgery, he developed a pulmonary embolus overnight. He died shortly after.
Death, I don't think any cardiac surgeon really gets over it. You move on because you have to, it's your career, but I think death hurts us all. If we had not operated on, this patient would have been likely to die in the next few months. That is very clear. However, we feel it was worth the fight, and unfortunately we don't win all the fights.
But a large percentage do. CardioStart missions have a mortality rate as low as most top 10 centers in the United States. Of 547 cases conducted since 1987, 532 have gone back home to their families. And success stories continue. Cases like little Angelo.
Angelo was another PDA. He was our very first PEDS case on this mission, and successful, no problems at all, and must admit, he was another feisty little one. But he's done really well, so hopefully he'll go home tomorrow.